anchor before the results are announced. Everyone goes through the same self-doubts. When I got 115 rank, actually I was very happy. The same day, I got to know that I won't be getting a seat.
When you were feeling low, right, and when these ups and downs will come, how did you overcome them?
Sir, my family has played a major role. Whenever I used to feel my yesterday got wasted, they used to tell in the morning that it's okay to have 1 or 2 days wasted, it happens, but we have to pick up again and start again. So by around late Feb, I started making a GT error book. Bhatia face-to-face class was a huge stepping stone in my success, sir. So my college, Mandya Institute of Medical Sciences, our seniors were very supportive and they have always helped. Concise notes means that you highlight the notes in your own main notes in such a way that you exactly know what to read. Grow together, help each other, help your friends. Don't compete amongst your friends, please. And it will all be fine at the end.
So hello everyone, Dr. Nasir here, and I'm asking you the question today. Who is the person who got the first rank in May INICET 2025? What is the answer? Answer is everybody knows. And we have the honor of welcoming such a true inspiration to all the students of the entire country who is preparing for the entrance examination, Dr. Trupti B. So with that, I want to ask Dr. Trupti, how do you feel by achieving this great success?
Sir, I feel very happy, very unimaginable. And I was jumping, crying around everything when the result came out. I actually downloaded it from WhatsApp. A PDF was sent in WhatsApp and I downloaded it and I thought that may be wrong. So I waited to download it from the actual website which I had got actually stuck. And then after downloading only I announced it. I told my papa about the result. And he was also very happy. He was also crying.
So the next question what I want to ask is, why did you become a doctor?
Sir, there is a very close person in my family who actually has presenile dementia. So I've been seeing this from a very early age. So that motivated me somewhere to get into the medical field. And there are also people in my family who have stroke, multiple people in my close relatives having strokes. So right. I'm more oriented towards medicine and neurology as such.
Now what I want to ask her is, why you desperately want medicine?
Sir, actually when I came in, when I started, I used to tell I want to become a surgeon. Because I think as a child, everyone knows only 2-3 fields, surgery, obs, gynae and pedia. So I used to tell I want to become a surgeon. But as years passed, when I completed internship, I realized I was searching for medicine cases even in the surgery wards. I used to hear murmur and I used to be like, nice, that is nice. Even in surgery patients. So that's when I realized I actually miss medicine more.
Okay. So during the course, you realized you miss medicine more and you decided you want to take medicine. Yeah. So guys, if you don't know, I just want to tell you one thing. So she got 115 rank in November INICET. But she didn't get medicine because medicine got over for 111. And she took a decision to repeat. And that is a big decision. And you know, all family members will say, hey, no, you have got such a good rank, you have to take the seat. It is very difficult to take a decision after getting 115, not to take the seat and repeat. So how did you take such a big risk and what was the situation?
When I got 115 rank, actually I was very happy. I thought, isi baar mein nikal gaya, acha hai. But then I realized the same day I got to know that I won't be getting a seat. I felt a little sad and 2 days I was very sad, but then I messaged Tamim sir about what I should be doing. And then he called me immediately and he made me realize that I never got time to study for that November INICET. I was always preparing for this year's NEET. So after he made me realize that, I got back my confidence and from the 3rd, 4th day itself, I started
So what did Tamim sir say that you got this confidence?
Sir, he made me realize that classes got over only in October and he told that you would have hardly read some 5-6 subjects, I think. I realized, yes, I had actually read only 5-6 subjects and gone for the exam. I had not even revised one round of all the 19 subjects. So then maybe I could do better.
Yeah.
Dr. Tamim sir also said that you have always been listening to people who say people get worse ranks after their first attempt. But I have seen many examples who have got better after the first attempt. So that also got back the confidence in me that I can do better probably.
You know, journey of this entrance preparation is not a smooth journey. It is a roller coaster. Many ups and downs will come, right? Sometimes you feel very low. So Trupti, when you were feeling low, right, and when these ups and downs will come, how did you overcome them?
One thing which helped to regulate the emotion was the morning sessions. Rajat sir and Praveen sir used to take the morning sessions, and whenever I used to feel my yesterday got wasted, they used to tell in the morning that it's okay to have 1 or 2 days wasted. It happens. It happens with everyone. But we have to pick up again and start again. So I used to feel confident, and sometimes I used to feel very low. So I am a little emotional person, so I used to cry. And then after that is over, I used to feel relieved and start all over again. And sometimes there were days when seeing my GT score, I used to feel overconfident. And overconfidence also leads to more mistakes. So after doing mistakes, I used to come back to again normal.
And also you said you used to cry so that the emotions should go off.
Emotions, if we store more, I think that also affects. So I used to cry and relieve.
So 100% right. Now I want to ask Trupti, what kind of student you were in college and how did your college support for your success?
So my college, Mandya Institute of Medical Sciences, it is a very sweet college. We all the professors, all of them supported us during our MBBS days, and most importantly, we were exposed to the clinic, adequate exposure to the clinics. So it was a very nice experience overall, and I have been a topper in class. So
She was the topper in the class. Okay.
Right from the childhood, she is always on the merit list, top. So in Kendriya Vidyalaya, in Surat, she studied. She was the top one amongst the topper. In Kendriya Vidyalaya, ISC Bangalore, she was one amongst the topper. And she is topper in the Mandya Institute of Medical Science. What else I think?
And do you have study environment in your college? Matlab, like see your seniors and all, they have created a study environment that yes, so that you can get in motivation. Yes, we have to prepare for entrance from the beginning.
yeah, our seniors were very supportive, and they have always helped, be it our immediate seniors of UG or be it our PGs. They have always been supportive.
Now I want to ask, how did Bhartiya face-to-face classes, which you have attended, support you for your success?
Bhatia face-to-face class was a huge stepping stone in my success, sir. Um, we have really enjoyed those 6 months of face-to-face classes, because sitting together, many people from my own batch were here. So we used to sit together, encourage each other to listen to the class, and sometimes if someone feels sleepy, wake them up. And we have really enjoyed, and all the faculties were so good. Um, like making the crisp notes and trying to answer the questions asked by faculties in class, and trying to solve each other's doubts and take different doubts to faculties and asking them how what was wrong, where we went wrong in understanding. So each day-to-day doubts actually got clarified then and there.
Like how faculties matlab, contributed for your success, and if you want to name some faculties who really matlab, helped.
First of all, I would like to thank all the Bhatia faculty, sir. There were, all of them are very good. To name few is very difficult, but I want to start with Tamim, sir, because he's been an inspiration from me. I used to come and ask doubts to everyone, but when it comes to Tamim, sir, I used to push my friend forward. I was so much inspired by him that I used to always feel that I should talk to him only after I do something good. When I see Tamim sir, I always feel he knows all the 19 subjects. So it inspires me more to take up medicine specially. And all other faculties, sir, Rajat sir, his radiology was so clinically oriented that whenever I used to start from radiology, I used to feel, yeah, I have touched all the subjects once, now I can I have connected to all the subjects, and now I can revise the other subjects also easily. And Praveen sir, his 5 minutes revisions in between the class, morning revision sessions, they were so effective. Sir, your notes, sir, your notes were so crisp and actually precise. If we remember them word to word, nothing will be outside the notes. And Rajiv Shetty sir, his PSM is also very, very concise. We can revise it faster also. And Jay sir, he has been always a support to me because I used to feel a little difficulty in remembering the flow, next steps in the flow charts. So, and correlating it with the question. So, whenever I used to write GTs, I used to have send him photos of the questions I've done wrong. So, he used to always reply back to me. Even after having such a busy schedule, he used to reply back to me about the answers. It was a very nice experience.
Now coming to the main pillar, let's talk about her preparation strategies. What were her specific preparation strategies? How did she study and from what did she start? And then how did she continue? Which is very important. Planning. Planning is everything. Please.
So mainly, I started preparation for oriented to NEET or any of the exams was from April 27th when I joined Bhatia.
So you started face-to-face classes April
27th.
27. Okay.
So after the classes got over at around October middle.
October middle.
October middle.
So you tell students what did you do from the beginning of the classes till the end of classes, April 29 to October.
So from in these 6 months, I focused mainly like when the class was over, I went back on the same day. I just took a fast glance of whatever was taught in the class. Sometimes if I sit and study the full thing, it would have taken a longer time. But I thought I used to go in a fast glance on the same day, and in between the breaks, I used to spend a little more time. But for example, if I have a subject like a small subject, if for example Dharma, and I'm getting a longer gap in between, I'll include a previous subject which is more forgettable and read only the topics which are important from it. Like if biochemistry was the first subject which was done for us, so I would include its important topics like only glycogen storage disorders, lysosomal storage disorders, which are frequently asked in that small.
What about solving questions during this phase, during the classes phase, solving questions? How many questions you used to solve during the coaching phase,
Yes, sir.
classes ka phase?
So after, on the day of the class, maybe we were not able to solve so many. Initially, especially, we did not have the momentum of reading. So, but
As the time went.
as the time went, I started solving some of the questions, some questions maybe some 20-30 per day. But in the gaps, I used to make sure I finish all the PYQs. So except 1 or 2 subjects, I had done all the PYQs during the class itself. So
Then how many GTs you gave during this phase? So we are just discussing the phase from her phase of classes while she was attending classes. How many GTs you gave during this phase and what was the frequency?
sir, it was monthly once. I started around June, sir. June first week, or I think May
And
end.
you gave monthly ones.
Monthly once.
So were you reviewing the GTs?
Yes, sir.
Because you won't get time during the
Yes,
classes
sir.
to review.
I reviewed only the subjects which were done
Okay.
only
Reset.
during the classes.
Uh-huh.
And I planned GTs in the gaps which were there in between. So whichever subject I had a larger gap, I used to give a GT in that, not on a specific date. So, and I used to review only the subjects which were already done.
Then how did you start your revision? How many revisions did you give after the classes?
So after the classes, I started my first revision. I took 2 months. I think 2.5 months I took for my first revision.
Okay.
And I planned to go in depth into the subject and solve. I used to solve around 50 questions per day in my first revision, sir, because first revision I thought should be more focused onto the notes because content is important. And after actually the classes ended, I increased the GT frequency to twice per month.
And I heard that you are making some GT error book. So that is, I'm hearing for the first time GT error book. I just want to know what is the GT error book and why did you think of making it?
Sir, me and my friends were discussing about it, and we thought of making a GT error book. And I started it only after my score reached around 140. Till then, I did not think of it. So by around late Feb, I started making a GT error book, and initially I used to include only the contents which were from my notes, but I still did it wrong. After reaching around 155, 160, I included even those things which were not there in my notes, but were answered by a significant percentage of students.
This is very important. I want everybody to make the GT error book. The next question what I want to ask is, when GT error book is over, the next question will come. Everybody is waiting. Wait, what about the 20th note?
No sir, I did not make my 20th notebook.
This is really shocking to hear. So every topper will make 20th notebook, right? And she is telling she did not make 20th notebook. Yes, everybody want to know the story behind it.
Sir, I believe in having a pictorial memory of the subject, sir. But I still had doubts when everyone used to say that they made 20th notebook. But I became confident about my point of view when one day Rajat sir said that concise, someone was asking him how to concise notes, and he told concise notes means that you highlight the notes in your own main notes in such a way that you exactly know what to read. So that's when I realized, okay, maybe what I'm thinking is right and I should not make another notebook and just go on with that, because it helps in having a pictorial memory.
Now, I want to ask Trupti one thing which is going on in your minds. What was her GT scores while giving the GT, right? That everybody wants to know. So, Trupti, what was your GT scores and how did they improve, or they were constant? And if they were constant, what did you do to improve them?
Sir, initially when I gave my first GT, it was around in hundreds. I think 109 or something.
Correct answers.
Yeah.
109 initially.
Initially.
Okay.
My first GT score. And then as we covered more subjects, it started increasing. Actually, sir, after NEET, I had got 143 correct.
Okay.
And when I came back and gave GTs, my score subsequently dipped from the NEET. So I became a little nervous, and but I kept on revising the subjects, and it eventually improved, and it became constant at around 160s at late.
So you gave the GTs from which platform?
So I gave all the GTs from Marrow, and there was a point when my scores were at around 160, and I was having a doubt that is it because I know the pattern of Marrow or I know a few questions already.
Now I want to ask her one important thing. What is that? FOMO, fear of missing out. That is very important in this present situation because we have multiple sources. Students are not satisfied with whatever they opt, right? And with that question, I want to ask her whether she had FOMO and how to overcome that FOMO, and whether you should have FOMO or not. Answer.
Sir, I did have FOMO about many resources are available now. So I had FOMO. I have asked seniors, I have asked our faculties about different, should I do something else? And most of them suggested that stick to the thing we are doing. And even I felt the same thing, because once we are done with, once we have done something, we should have full faith in it and we should revise it multiple times. Sometimes we don't know what is there in the notes itself, and we keep running here and there to get everything. Even when my score in GT was 160,
Okay.
the mistakes I was doing were still there in my notes. So I don't think we need to go around different sources.
And you told your friends contributed a lot to your preparation. Like,
Yes, sir. We had a group where we used to share our doubts, and whoever knows that topic well would answer it. And I think that made a significant change in how we look out. Like sometimes we don't even understand the question, so it made each other understand the question and solve it better.
but don't it increase FOMO that she knows I don't know?
Sir, I think we should not compete amongst friends.
That's what I wanted to tell you, people.
We have 2 lakh people to compete against. I think they should not be at least our friends.
Right, other than Bhatia face-to-face classes, what else you have done? Other things.
Sir, I have done one shot in January.
One shot, a short course
shot.
taken from Bhatia. Okay, then.
When I was doing the first round of revision, I thought whichever subjects I was feeling a little difficulty in solving, I saw few TND, not complete, but few TND videos of those subjects.
Again from
Our
Bhatia.
Bhatia.
So you said one shot, right? Our short course. What I believe is one shot is to next level. But I want to know, that is a faculty point of view. But I want to know as a student point of view, how one shot helped her and what did she feel about one shot? Whether to attend or not, is it really helped or not? Your genuine reply we want.
So one shot was really helpful. I attended the January one shot live. So it was like a quick revision of all the subjects within 6 days, and then I could start my second revision. In the last one shot conducted just before INICET, I did not attend it live. I watched the second year subjects and surgery one shot and revised the other subjects. So it was really helpful because especially pharma and surgery, I could revise it very fast, very quickly. Like I watched the one shot in the morning, and in the remaining time of the day, because I had planned one day for a subject, in the remaining time of the day, I used to go through whichever topics need more detail.
Again, did you revise one shot later?
So I did not write.
Revise one shot later?
No,
Any?
I did not make a one shot notebook. I used to correlate one shot with my class notes, main notes. I used to sit with my class notes.
That is very important, what she is telling. Again, it is subjective.
Actually, when I was going to repeat this year, I thought maybe the people around me, my friends, my seniors might tell that why are you repeating? You should have taken a seat. But my friends never discouraged me. They took my decision. They encouraged my decision, and most importantly, they told me never settle for anything less than what you deserve. So I think somewhere that boosted the confidence in me, and they had more confidence in me than I did actually. So
See, like in this kind of situations, we are taking a risky decision. Support is very important. And now I want you to tell the support from your family in your preparation.
sir, my family has played a major role. I think when I had to take this decision, one day I went to my father and told, I'll forget what happened in INICET. He told, exactly this is what I was about to tell you. Let's forget this INICET. You are anyways preparing for next year, so let's not bother about this, and you continue your preparation the way you were doing. Also, if somebody used to tell him that she should have taken a seat, that message has never reached me. So I think because he acted as a buffer in between, I could focus more.
That's a great thing to hear from your father, how he supported you. That is very much needed. So one important question now, what I want to ask her is how many revisions she gave and how much time she took to complete those revisions.
Sir, I gave 4 revisions after the classes were over. The first revision, I took a longer time. I took 2.5 months to complete it. And then with each revision, we have to increase the speed of revision. So what I used to do was, while making the timetable of a new revision cycle, I used to include the subjects which I like first, so that I gain the momentum, and those subjects which can be revised faster. So in that, I felt I used to start with either radiology or microbiology, sir, because microbiology we have we can revise faster. Like final revision, I think I revised it in 2 hours. So so that speed, it helps to gain the momentum, and then I would plan my difficult subjects or lengthy subjects. And I gave total 4 revisions, and the final revision was, I think, around 20 days.
So first revision tended approximately 2.5 months. Second revision approximately.
Approximately 1.5, I think.
Okay, third revision.
Third revision, 1 month.
1 month. Okay. Finally, you gave the one complete revision. You went to the exam.
Yeah.
And number of questions. Initially, how many questions you used to do right from first revision to fourth revision? Did you increase the number of questions?
Yes, sir.
Like all toppers, they say 100 questions per day we have to do. You were doing 100 questions per day or less than that? How did you, number of questions you planned?
Initially, I did not do 100 questions per day because I focus more on the content. So maybe around 50. I did not count yet, but I think it was around 50.
After that?
After that, when next cycle, I increased the number of questions. I think it reached around 100. At least on an average, reached around.
So this is very important.
And sir, the questions which I did in the first round of revision were actually only PYQs.
Okay.
I did not go to the extra questions.
Again, this is also very important. I always say PYQs are more important than any other MCQs. Common sense. So be thorough with the PYQs. Then we can do as many as MCQs you want. So now I have told you I have given 4 revisions, tentatively how much time you have taken. And now I want to tell you how many questions you used to solve and how much time you have taken from the beginning.
Sir, I used to solve marrow questions. In the first, when the classes were going on, I used to give around, I think 90-10%.
90-10. 90% to the notes, 10% to the
Yes,
questions during the class.
During the class.
After that first revision.
After the first revision, during the first revision, I think around 80-20.
80-20. 20% of the time to the questions.
Questions.
Second, third revision.
Second, third revision, I gradually increased
Increase to
it.
30, 40, finally.
Finally, I
Highest.
think 50-50,
50,
60-40.
50. So this is how we have to do. You have to start questions like 10% of the time, then you have to increase slowly when you get the confidence in the class notes.
notes.
And again, let's talk about the GT review, right? You told initially you were reviewing only few subjects which you were getting over recently, right? But obviously at the end you have to develop that, you have to review the entire GT. Tell me about the GT history, GT review history from the beginning. During the classes you started giving GTs then.
So during the classes, I used to review the Marrow GTs from like I used to review only the recent subject which were over, and by like when we reached towards the end, I used to include all the subjects which were done. And when I started my first revision, I reviewed all the 19. I used to review GT on the same day, sir, and I used to sit with all my 19 subject notebooks and review the wrong questions from the notes instead of reading the explanation, because I think there is some logic, something which we know half, due to which we have answered the question wrong. So the two options which I got confused, maybe for example, if we have an image of satellitism and I might confuse it with the camp image. So I used to see both the images and I used to try to differentiate, and sir, I included those mistakes in my GT notebook also eventually.
And finally, when you started reviewing the entire GT from first revision
From
onwards.
first revision onwards,
So initially during the classes, only few subjects. And after that, from first revision onwards, start reviewing the entire GT and see where the confusion is happening and see where the mistakes are happening.
Yes, sir.
So, Dr. Trupti, what do you want to say at the end? A concluding statement, a message for everyone.
So I want to tell everyone that please trust the source you have taken, and please trust yourself. Grow together, help each other, help your friends. Don't compete amongst your friends, please. And I want to say that no one is a ranker before the results are announced. Everyone goes through the same self-doubts. And so please, whenever you go through self-doubts, try to overcome them and start working again. It will all be fine at the end.